it's more about becoming a good doctor than it is about just passing the exam. And if you are a good doctor, by default, you will also pass the exam. Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
Hello guys, and welcome back to another episode of Coffee on Call, done by Foundation Doctors, the Foundation Medicine podcast. My name is Varun, and I'm joined by Richard.
Hi.
And Rachel.
Hello.
And today we'll be discussing some of the elements of final year that we all went through, and some of the elements that we'd like to change for final year, and what you can do to get out of final year. To kick things off, Richard, what do you think went really well for you in final year?
So I think people get really fixated on kind of passing an exam, but obviously the actual goal is to go from being a student to being a doctor, and it's more about becoming a good doctor than it is about just passing the exam. And if you are a good doctor, by default, you will also pass the exam.
Yeah.
So if you focus more on picking up as much info and learning as you can from the doctors and placement and things like that, then kind of almost by accident, you'll pass the exam anyway.
Yeah.
Obviously, caveat being that you obviously still need to revise.
Yeah.
But I think if you turn up and you really make the most of placement when you're there, that's the most important thing. And then when you can really hit the ground running when you start F1.
Fine. So you'd say like trying to take more information just from viewing it. Yeah. Would you agree?
Along those same lines, I would say focus a lot on the skills of being a doctor. So things like bloods and cannulas, really hone in on those skills. I know that you might only have to do 3 or 4 to signed off or something to pass the year. But actually, when you are your day one F1, those are the skills that you're going to have to do. You are going to have to cannulate and take bloods by yourself, and there isn't an F1 that you can then ask to do them when you miss. So practice.
Okay.
Yeah.
And do you feel the step up that you've done from third year, fourth year, or the other pre-clin years, what would you say you'd have done most differently in final year when you guys did it?
I think a lot of it is, like we've said, it's about that transition to an F1. And I think by spending more time with the F1s and really learning what their day-to-day life is like is really important. So, it's about the information, it's about passing your exams and about doing the skills, but it's also about, if you are going to be in that trust, how do I use the computer systems? Can I make those phone calls? Can I do an effective handover? Things like that. And practicing all of those skills whilst you are still a student is completely invaluable.
Sure. Did you find any challenges juggling that, knowing that that's what you're going to be doing as a junior doctor versus the other learning that you needed to do to pass the exams?
Obviously, you need to sometimes revise. That's fair. But I kind of approached it like going to placement was kind of like going to work. So rather than just going and then thinking, at the first opportunity, I'm going to slip away from this ward round or whatever the vibe might have been in earlier years, I would try and think like, okay, this is going to be me. And in 6 months, I'm going to have to be writing the notes. I'm going to have to be coming up with a jobs list. I've got to prioritize the jobs. There's a difficult conversation to have. I want to see how that happens. Maybe I can ring the radiologist and sort out this scan, or maybe I can take this referral, or I can have I can make this phone call. So I treated it a little bit more like I was going to work.
Right.
And then when either the ward was very busy or where the doctors had essentially had enough of me or whatever, I would then that would be my cue to go and get on with some revision and balance it that way. But I would try and take it when I was there. I was like intensely and intentionally working and doing stuff that I would then be doing when I was an F1. So it might not be that I'm physically being taught about asthma, but I might be able to be having a difficult conversation on the phone or taking a referral or chatting to a senior or something like that. So that practicing those things, because those are all the things that people find a little bit more intimidating when they start F1.
So it sounds like a lot of what we're sort of talking about is just mimicking what we're going to do as an F1 realistically, and trying to balance it in an appropriate way that still gets you to learn going
I guess
forward.
it's kind of treat it like an in situ simulation as such. We have those simulation teachings, but there's nothing more real life than doing it in real life. So that'd be my
exactly
advice
on that. Would you say that there's anything that could be gained perhaps from just like picking different shifts to possibly shadow somebody?
I think some of my most useful shifts were when I did do the out of hours stuff, especially towards the end of the year. I think there's a lot to be gained. Those are the things that you're most nervous about, aren't they? When you finish final year and you know that you've got F1 approaching, it's the out of hours stuff that you're really kind of you're nervous about, and what am I going to get bleeped about, and what is it like doing an evening or a night shift or a weekend. and most med students will get the opportunity to do that. And, you know, even just arranging it informally with an F1 who you meet during the working week and just saying, you know, can I join you for a couple of hours this evening? And it doesn't have to be for long, but even a couple of hours can be very valuable in gaining skills and confidence and just knowing what the job entails out of hours.
Yeah, totally.
Yeah, I really like doing twilight shifts as a student.
Yeah.
So I quite liked arranging. Obviously, you have to mix it up. You have to do some ward rounds. But during the placement, I would ask if I could do some twilight shifts, because then you can have the morning as your own time to do some work and some revision. You can hit the books. But then if you come in at 2 for your twilight shift, that's when all of the ward jobs are going to need to be done, because the junior doctors will have finished their ward rounds. And that's when it's a really good time for you to get all the skills done. There might be patients to review. And as you say, that allows you then to take it into the out of hours and maybe engage in a handover later on. So that day is then really efficient. You had a few hours to revise in the morning.
Yeah.
If you're disciplined about it and you get up, a few hours to revise in the morning, turn up to the hospital, get a really good, productive day of placement where you maybe do a bunch of clinical skills and review some patients with supervision, do a handover, and then go home. And that's like a really good day of learning.
So I guess it's all about making sure that you make the most efficient use of the time when you're in hospital for the learning that you need to do.
Exactly, yeah.
Specifically going on to, you know, as obviously every med school has slightly different assessments and examinations. Is there anything to be gained specifically from placements that you guys wish you'd have done going forward with those at all?
So I was going to say that when you're a student, obviously you're really focused on things like passing your OSCE that you're going to have to do. And one of the best ways to practice for the OSCE is obviously to practice examining people and practice doing the stuff. But if you practice all the time on your friends who are all medical students, they know what to say and they know what you're going to do next and they lead you through it. Whereas the ultimate way of practicing the examination is obviously on patients, and the hospital are full of patients. So obviously the best way to get the most out of your prep for the exam is to go to the hospital and examine all of these patients who have all the signs and have all the rest of it, but they don't know how to teach you it. So therefore you're having to draw it out of them and you're doing it properly. So
It's something you have to pick up yourself a
it's
little
the
bit.
ultimate OSCE prep.
And I think also on that note, clerking patients yourself. So, you know, if you are in ED, take the lead and go and see a patient by yourself. If you're in the surgical assessment unit, go and see a patient by yourself, and then present it back to a senior and get feedback on that. And that's the best way to learn.
Yeah.
I think setting clear expectations, you know, you go to placement and if you have really clear expectations and things that you want to get out of the day, then it makes it really easy to communicate with your team that are supervising you. Because if I don't know about you guys, but when you have students who come, if you say to them, what do you want to get out of today? And they kind of say, oh, I'm not really sure. Or, oh, I want to do respiratory, which is an enormous subtopic of med. We clearly can't cover that in one day of the ward.
Yeah.
But if they come and say, I really want to do a focused respiratory history and examination in OSCE conditions and get feedback, then you can go, oh, I can do that because I know I know what you need. And then it's really, so that sort of direct communication. And the other thing is just introducing yourself. So when don't turn up 20 minutes into handover, stand in the corner quietly and then not say anything, because it's really awkward for everybody. Whereas if you turn up on time and say, oh, hi, I'm the final year medical student, I'm going to shadow you today if that's okay. This is what I need to get out of it.
Yeah.
It's more like you're part of the team then. I think that's really important.
No, for sure. And I think actually a lot is to be said, as you've mentioned, Richard, there, that introduction and coming in with an idea of what to say often makes it a lot easier for us as junior doctors to know exactly how to target, because we were all medical students once. We all know what we need to get out of going to placement. But ultimately, how to target that information can be quite challenging unless someone tells you directly. So I think that makes.
And I know you said about earlier about ward rounds. I think for fifth years there is a use in them as long as you're coming at the start and acting as if you are the F1.
Yeah.
So write in the notes, and you know, if the F1 is doing an independent ward round for those few patients, you know, go and lead that ward round, and you can always get feedback and you can always discuss problems, concerns with the F1, with the seniors there, but treat it as if you are the doctor. And as that is your learning experience.
Yeah.
Yep. Did you guys enjoy your final year at least?
I actually really did.
Yeah.
Like, because I took it as an opportunity to essentially be the doctor for a year with a safety net of there being loads of other doctors around to like, take up the slack if I made a mistake or anything like that. So I really enjoyed it. And as I say, I think if you take the opportunity to have a bit of agency over your time and say, you know, advocate for yourself and say things like, can I do a twilight shift? Can I do this? This is what I need to get out of it. And actually having clear expectations and goals, I think it's a really good year.
It's a really good year.
And you start to feel more like a doctor.
I'm a big advocate for the phrase of, you get out what you put in.
Yeah.
And I think that's definitely the case for fifth year is,
Yeah.
you know, if you put in the effort, you introduce yourself, you go along to as many different things as possible and you practice as much as you can, you're going to have no problem whatsoever when you get to the first day of F1.
Sounds smashing. Just a final one to wrap it up. If I asked you guys to give one thing that you want to say back to your final year self as you were starting it, what would you guys say?
I would definitely say to anybody doing final year, when as soon as you get to placement, ask if there's an opportunity to do twilight shifts where you can focus on your revision in the morning and then come in and do clinical skills repeatedly and get feedback from the doctors. That's how I would address it.
Nice.
And I would just say, get involved and do that live simulation of being an F1 as much as possible in as many different scenarios as possible.
Absolutely spot on with everything that's been said here. And I think that's the big thing that I'd probably say is like going forward, the frame shift and the attitude change that happens when you go from being a penultimate year to a final year medical student is you need to just imagine yourself as the doctor from now on. And so putting yourself in that area of responsibility and just knowing that this is what you need to do and achieve. It's not necessarily you getting told what to learn. It's that you will do all this yourself.
Yeah.
And that I think is the biggest important thing that make you stand out as being a good F1 going forward.